Okay, we are going to continue on our learning journey in fundamentals of therapeutic massage. And the last chapter we did was chapter 10, which was the learning how to do a massage and beginning to understand the idea of assessment and intervention. And so once you perfect the full body massage and variations on that in terms of different pressures and positioning and a mat, a massage chair, etc., the more easy it'll become easier for you to start to pay more attention to how is this joint moving? How does this tissue feel? How is this symptom that the client has talked about in their goals? How is that potentially manifesting in their physical body in a way that massage might be able to do something with? That is much harder to do if you are still wondering about, now, how do I place the bolster? And what part of the body am I going to massage next? And how is it that I hold on to the ankle to move the leg? Those movements have to become habituated in the sense that you don't have to think about them. And so it's really a practice. Now, many will not, in fact, most will not achieve that habituation while they are in school on the general protocol. And how valuable doing massage with the relaxation and stress management outcome is. They will rush into the idea of wanting to find what's wrong and then try to do something to reverse that. And while that is part of what we do with massage, most things sort themselves out in the context of the general massage. With variations in pressure and speed and all the different modifiers, and that's one of the most important things we do. So whether it is a relaxation well-being outcome, or it is stress management, pain management, functional mobility, most of those situations that might be functioning a little non-optimally will sort themselves out with a full body massage. Now, the next step on that is to use assessment to become more focused. Now, initially, we are always doing a level of assessment when we do the client history and we're screening for contraindications so that we remember safety is first. That is assessment. Cat just jumped up, but the birds aren't tweeting. So the assessment process is always occurring, and we get better and better and better at it as we learn to pay more attention. And so there is a learning curve here. So sometimes students find it a little difficult to process these more focused assessment procedures and reconcile that with a full body massage. And you will find, again, I'll say this one more time, once you fully own the procedures in the full body massage and in their variations, the idea of the palpation assessment, the joint movement the joint movement assessment will become, you'll be ready to process that information. So this chapter then lends itself to ongoing study. This is one that you will be able to integrate content as you go into your first and second and third year of professional practice. Many continuing education classes that are out there will be presenting concepts that are very similar to what you find in this chapter. So we're gonna go through in this video the features of the chapter, and that certainly in class we will be looking at how we can incorporate these various assessments within a general massage application without breaking the flow of the general massage. Okay, so the next part of this then is intervention. That means you're wanting to trigger something to change. And that may or may not be appropriate. So we want to remember that we would not do any kind of a manual therapy / massage approach that is primarily an intervention until we have done an assessment to indicate that that intervention has a likelihood of creating some benefit. And if the client has the appropriate adaptive capacity to respond to that intervention. And if the focus of your massage is palliative, the massage itself is a gentle form of intervention. There really is no attempt to assess for a reversible function or pathology and try to come up with a long-term treatment plan. It's about what does the general relaxation response do. If we are looking at restorative approach to care, then we can use various assessment procedures to try to identify where there needs to be an additional focus in order to support recovery. If we're working in a condition management approach, then what we are doing is assessing to see what is the current status of the client. Did what was performed in massage the previous time have a beneficial effect, and do we want to continue with that or add something onto that? What can we do during this massage, and how much? What are the cautions in through there? Remember, condition management, the goal is to sustain and improve a quality of life, not necessarily to reverse. And then finally, therapeutic change, that becomes the time that we would assess for to try to determine both what is functioning well and where there might be some dysfunction, and how that might be able to be reversed with an intervention. We don't do that very much. And we would like to think that we do, but we don't. That would fall more in line with physical therapists, for example. Now, that doesn't mean that there isn't value in a therapeutic change approach to massage, but typically you would be involved with other professionals that would be doing a lot of the assessment. So that's very helpful. So if we can finish up this introduction with this, just to say we are always assessing, always. We're assessing for the client's response. We're assessing for comfort of the client. We are looking for functionality. What is working well? We're looking for areas where with a little tweak here and a little tweak there, here tweak, there tweak, everywhere tweak, tweak, that we might improve function without challenging adaptive strain with a client. And so there's where this chapter starts to bring an increased awareness. So we have to consider where the client is before we start. You can't measure a result if you don't know where you start. So that's pre-assessment and then post-assessment. These need to become part of every massage session then. So let's look at this, and we have an understanding of how this skill set will progress with more experience. Share the screen. So here is chapter 10, and as you know, we are going to look at our chapter objectives first. And this gives you a general idea of the various types of assessment we are going to learn. And then what are the objectives? So assessment is fact gathering. It's observation, it's listening, it's challenging certain tests. Well, assessment tests will challenge the body to see how it functions. But it is not intervention. Assessment is not trying to reverse it. My cat is determined to be part of this lecture today. So interventions, there aren't very many. And that will come, all right, what do we do if we find something during assessment? That will come in clarity of another video that is a companion to this one. This one is primarily to get us to understand the content in the chapter. So read your chapter objectives, understand your key terms. This is kind of what I was just chatting about. So there's two parts here. We have procedures for assessment. And then we have how we interpret the information that we find. So different disciplines might interpret the information a little differently. And they might even have a few different assessment procedures. So if we're going to work in a multidisciplinary care environment, then we've got to understand how they assess and how they interpret. And then we need to be able to logically explain how we do that. And you will find that we're more alike than different on this. Pay attention to your examples. Read your mentoring tips. So the other thing I want to point out on this as we get into this part of the textbook is that, yes, I'm going to read part of this. Yes, you can go through the steps of giving a massage and not paying attention. Functioning as a massage technician. So you do this part, and then you do that part, and you do the other part. But if you want to function as a massage therapist, you can use massage methods in a way that ask assessment questions, and you can provide appropriate intervention when needed. So if the end of your learning was chapter 10 and we did not progress into chapter 11, your skill set would be that of a massage technician. You know how to apply these procedures in this way. But if you want to be a massage therapist, and use critical thinking skills in a way that is going to support achieving outcomes of your clients, then over time, you have to understand and embrace this information. Okay. So in the very first part of this chapter, what we are doing is looking at the aspects of assessment. So first and foremost, what we want to do is to determine if the client should be referred. So we're always assessing for safety first. And then we want to discover any cautions that would cause us to modify the massage. Like if there was a cut or a scrape that we need to avoid, or if a person had burned themselves, or if their neck is particularly sore because they had been in a minor car accident, or if they had started a new medication, we have to stop and think about that. Those are the two that are critical, that we determine referral and we look to discover and think about how we're going to adapt the massage application. And then we're looking to obtain input from the client that can help us achieve the goals that they have for that massage session. And then we're looking to create a unique massage experience based on the goals and the categories of care to best serve that client that day and as part of a longer term treatment/care plan. So as we are exploring this, we have to, again, I want to emphasize, assessment does not change a condition, but it attempts to understand it. Because some things that you're going to find that seem to be strained or functioning less than optimally are actually what's called resourceful compensation. This is the way the person has adapted and responded. Right now, today, this is the best they can do with that. If we disturb that, then they're going to have the potential for an adverse effect. And then we have to stop and think about what type of intervention we are going to use. And you're going to hear me say over and over and over, less is more. And that the full body general massage done intelligently will likely be what you will need. That will be your intervention. But there are some ways that we can narrow the focus just a little bit. That could be one of the muscle energy techniques that you learned in chapter 10. It could be inhibitory pressure. That's a sustained pressure, sometimes called ischemic pressure. We might use methods that create a shear force, a friction type method. We might alter the drag a little bit to support connective tissue sliding. But if those are sort of woven into the general massage, then you don't sacrifice the full body experience that is unique to massage therapy. Now, we all compensate, every single one of us. And so those compensation patterns are a solution. And until we understand the issue and its solution, we want to be cautious about being aggressive. So here's the data collection process. We've got what the client wants. This is their outcome goals. What is their experience? And then what could be a contributing factor? So in that sense, then, we collect information, and this is all part of assessment, in a history form, a physical assessment, lifestyle, and other things that might be going on. So let me give you an example of this. I have a client I have seen forever and ever and ever. And they have changed their exercise program because of the pandemic, and they are walking their dog now. And he's a pretty big dog. And this person has a past history of being involved in an occupation that had a lot of physical performance demands. And he's older now. And so as a professional athlete, you don't get out of that without wear and tear on your body. So this is a change in activity, walking the dog. And there's also been a lifestyle shift away from the exercise process that his body had become used to. And he's walking the dog outside and walking on the road and on sidewalk. So the surfaces are uneven. There's also hills. So there's a lot of up and down the hill, and holding the leash of a dog, which is going to cause a pulling action, and there's going to be some twisting and torquing that goes along with that. So the physical assessment is going to be palpation and postural assessment and joint movement and all of that kind of activity to look and see what the current state of the physical form and function is, and how that has shifted from what is been the norm, what has been the norm, how has that shifted based on this change in lifestyle and these external factors. So the symptom the client came in with is he had some strain on one ankle, and they didn't like that. So my brain starts to go, well, okay, what could be all of the potential things that could be causing this discomfort? So I ask a lot of questions, and I have some ideas about what might be going on. I think it might be a little bit of an altered gait and the uneven pavement, and the difference between a normal slope on a road and the sidewalk and the hills. And that because it's on one side more than the other, it may have to do with walking a little bit on a slant, and that is straining one ankle more than the other. So what I want to do with this then is I want to gather all this information, and I start to follow this algorithm down. I'm going to come down, and I'm going to work off of this hypothesis, this guess, that there is a logical idea of what's going on with this ankle. And I'm pretty confident in my skills on that because I've seen it before. So I I'm not really thinking I need further research on this. So I'm going to screen for my contraindications, and I'm going to ask if he's had this looked at by somebody else, and this individual does see a chiropractor. And he had it looked at, and the chiropractor had done some adjusting on it or whatever, but it didn't really make any difference. And they didn't have any specific recommendations. There were no other contraindications. So now I'm going to take a look at a treatment plan development. And since this is not a new client, I would use my general massage, the general assessment process, but I would be inclusive of things that may be affecting that ankle. So there would be additional assessment in that area itself, palpation and joint movement, and some muscle testing. And so I would go ahead and implement that plan. And you're typically not going to get any kind of real change that's sustaining. You're not going to notice it right after the massage. It's what happens a day or two later. But I'm going to have them move it around, see if it feels less sticky and stiff in there. And then I am going to give them a call and see what has happened with that. And then we will look to adjust with continued massage. Now, another way that could have gone is I'm unsure about it. Maybe there's a little stress fracture or something in there, or there might be some little sprain or strain that I am unaware of. So I would refer, and I would want to know what, in this case, it was chiropractor. I'd want to know what they thought and how that might influence the massage. And maybe we need to end it for a little while and see what's happening. But more than likely, the client would come back with some recommendations. The chiropractor said that it looks like there was a little displacement of one of the bones in the foot, and massage is going to help that. And once the massage addresses the soft tissue stiffness, going to come back in and for adjustment. That could be how that goes. So this algorithm, it is helpful on how you think you're going to progress. It's not usually a straight line. If I think that it might be a new set of shoes or something like that, maybe we need to do some further investigation and take a look at that. So this is a little example of how you think your way through a session. Now, each outcome has its own assessment baseline. And so that's what this is discussing right here. If your outcome is relaxation, then these are the types of assessments that you would take a look at. It's not a real in-depth physical assessment. It's more of a history assessment. When we get down to stress management, especially if there is some distress showing, now we have much more complicated assessment. And we'd want to look and see if there is autonomic distress by asking questions about sleeping and digestion and that sort of thing. There's much more potential here for the need for referral multidisciplinary care, especially if the symptoms are vague, which they often are. And so this would be not typically a single session here. We would be looking to create a series of sessions in order to be part of reversing a dysfunctional stress response. Same with pain management. And there might be additional scales like a pain scale or something like that that we would use. And then functional mobility, obviously, is going to have a more focus on joint movement, posture, gait, that sort of thing. We want to also establish that dysfunction or less than optimal, there's some solution in that. Everything you find, if you can think of it as a solution to a problem or the attempt at a solution, then you start to see the bigger picture of what's going on with that. And we talk about that in terms of possibly somebody is certainly experiencing a somatic aspect to attention headaches, but at the same time, there's a level of solution there because it's maybe triggering them to have a better work-life balance. In order to have these types of conversations with a client, you have to have rapport. And there has to be some genuineness there. There has to be a therapeutic relationship. And you have to be able to establish it quickly, fairly quickly. So I refer you back to the first unit, especially chapters 1 and 2, and the whole communication idea that goes along with this. Some people have a little harder time establishing rapport. Maybe a client has had a bad experience with massage, or maybe a massage therapist has, I have a visual issue. You are aware of that now. And sometimes my movements are just a tad awkward, and that can make the client wonder if there's something wrong with me. And that will interfere with the ability to establish rapport. So this connection is huge in terms of the quality of the therapeutic relationship. We begin our assessment process very quickly on how we observe what words the clients use, the gestures they use. There's nothing written in stone on any of this, but there is a pattern that will reveal itself if you observe the client enough, whether they are pulling at their neck or trying to stretch their shoulders or big heaving breathing sighs or whatever. And there's some suggestions here on what gestures might mean. This is based on experience. It's not validated in double-blind research studies, but it's a place to start to think about what stuff means. I had somebody mention today to me that they had a funny sensation, a pain in the calf of their shoulder. And I know from experience that that is a referral pattern for brachial plexus impingement. And so I did some assessment using palpation primarily and I felt down through here to see if I could find if I could replicate the sensation. And I could press on a certain area. I was over top of a scalene in there, and that would go right into their shoulder. And so then I did a little bit of an intervention. I did some ischemic pressure and had them move around a little bit. So that's the intervention I use a lot, inhibitory pressure plus movement. So, but I got the idea because they drew a line down through there, and that's often indicative of a nerve impingement. We also have to really learn to listen and to ask open-ended questions. And again, I refer you back to chapter 2 on that. And don't come to conclusions too quickly. Keep an open mind. Take time to do the proficiency exercises. And, oops. That overview leads us then to the idea of a physical assessment. So this is where your science book is going to come into play because you are going to be looking at posture in terms of bones and joints and connective tissue and symmetry and functional movement and all of that. So make sure that you are bringing your science studies into this as well. So chapter 10 in the Essential Science book is devoted to biomechanics and kinesiology. And you will see repeated information between the two chapters, which helps reinforce. And so I see this box right here, so I want to back up a little bit. This box 11.2 is a script for an assessment interview, especially an initial assessment interview. And it really gives you a true step-by-step process here. And what I strongly suggest you do is you practice this. You practice reading this script and then paraphrasing this script, whether it's with a fellow classmate or family or friends, so that this conversation becomes habituated and more natural. So this is definitely a slow down, pay attention here. I want you to be able to do this. So this is going to show up in the classroom somehow. I can pretty much guarantee that. Okay. So if we are going to gather data, then we have to have some documentation instruments that we use. And we talked about those already. That is your intake form, your physical assessment form, a treatment plan form. And so we're going to reinforce those here. And then this table right here also talks about the various applied force stressors that we actually use for massage, but also can be used for injury, physical injury. And then we also have this crazy figure here that talks about areas that are connected in function. So the shoulder with the opposite hip and the elbow with the opposite knee, and you follow these lines. And this all goes back to gait reflexes. That's what this is based on, as well as some levels of stability. And so if I can remember, the elbow, if it's got some symptomology, because it functions while we are walking in conjunction with the knee, I might want to think about these two together. I might want to assess them in a connected unit. So spend some time staring at this little diagram here to get those relationships. And as we are gathering data, there's what the client tells us. So that's certainly the pain scales and that sort of thing with the evaluations. And the VA has got an excellent pain scale approach, and that's available on your canvas for you. Or you can find it by Googling Veterans Administration pain scale. They have made that usable across the board. So here's a simple one that you've seen a lot. And we're trying to capture a subjective experience using some sort of external measurement with these. And then as we're gathering data, we're also looking at stuff that we can measure and touch. And this is where we're kind of looking at symmetry, and nobody is totally symmetrical. But we can see how far off symmetry somebody is. And we can look at freedom of movement. Those are things that we can pick up, and we can start to go, there's a lot of strain on the system because this movement is labored. There's a lot of adaptation around that. Now, a lot of things you find with asymmetry are probably not going to be correctable, but the strain it creates, the shortening in one area potentially and the elongation in the other, that can be modified for a while with massage. So the person can function easier, at least for a while, and that's got tremendous value right there. I really like functional capacity. What do you want to do? What is it that you want to do, and what is interfering with your ability to do that? And I can build quantitative outcomes and objectives with this, as well as some qualitative ones that I can measure. So people really like to look at what are they going to be able to, how are they going to be able to perform, or how are they going to be able to feel, more so than, okay, your range of motion of your big toe increased by 1/16 of an inch. So much of what we do when we do massage is related to palpation and then joint movement. And so here is a common pain graded scale. And we can use this to enhance our documentation. And the further we go up the scale, actually I'm going down here, but the higher the grade, the potential for referral increases. Same with the muscle testing. Now we've explored that a little bit in chapter 10, and we explored it a lot in chapter 10 in Essential Science. So this content's starting to overlap. And once we start to get down to a grade 3, 2, 1, especially if it's new, and there's no logical reason for it, then this would be an indication for referral. So as we start to think about looking at a person's posture, we're looking for two things: stability, primarily with posture, and then the mobility that would come from the ability to maintain our balance in an upright posture. Now, this box, I want you to stop, really stop and slow down on and pay a lot of attention to. This is going to lead you through a basic assessment and documentation process. This is very helpful. It summarizes for non-complex conditions. It really summarizes your process as a massage therapist. The forms here are so that you can recognize what form to use. So we start with informed consent, and then we get to our client intake and health history form. We're gathering data. We determine what our care treatment plan is going to be. And if it is relaxation well-being, then there isn't going to be a complex care plan. And so we're not going to have all kinds of postural assessment and muscle testing and all that goes with it. We certainly are going to assess for contraindications, areas of caution, and how we're going to adapt to that. And then we complete our chart. And that's the end, pretty much the end of the process for the relaxation outcome. However, if we start to get into stress management and pain management and functional mobility, now we've got to gather more information. And so in addition then to this, we are going to have our postural assessment looking for symmetry. And we're going to have a functional capacity assessment, especially if we're looking at pain management outcomes related to movement or functional mobility in general. We want to have an idea of what is the person's adaptive capacity. How can they process the stress of the massage? Because it is. So this is giving you some ideas of what we would look at. If we do a physical assessment, we look at the back. We are looking for symmetry. And we would be aware if there were areas where there wasn't. We would have them perform some functional movement tasks, like looking up and looking down, and we're comparing the quality of the movement from one side to the other. And this continues to go down through here and gives guidance on what types of assessments you would use, and then how you would record those. Same with a palpation assessment now. And there's a whole section in this chapter about what information we find by manipulating the soft tissue. And then once we have our impressions from all of this, we have summarized our findings, Then we pull that together into a care plan, which is going to span over a series of sessions. We would have short-term goals and long-term goals. Quantitative, where we can measure; qualitative, which is more related to experience. I can now climb 6 stairs, and it feels really good to be able to get upstairs to sleep in my bed. What is it that we are going to target here? I'm going to target muscle activation sequences that could help the movement up and down the stairs, for example. How many times are we going to see the person, and how long each time? What documents, what types of scales and measurement documentation are we going to use? And what would be how frequently are we going to assess for that? Every 6 sessions, every 10 sessions. And then categories of massage methods to be used. These are focusing on general functions, anatomical, physiological, functional categories here. So general constitutional, stress reduction, which would be part of breathing, circulatory, lymphatic, etc. These are just examples here. And then any additional notes. Client need to stay in the room with the client when they get up off the table because they have an inner ear issue and their balance is compromised. So this is our, okay, this is what we think we're going to do here. And then we're going to try to do it. And after every session, we are going to do some sort of a documentation of each session. And then at the end of the treatment period that we have defined for reassessment, let's say it's 6 sessions, we're going to go back and thoroughly evaluate how far we've come, and are we achieving our goals, or do we need to add something or take something away, or what adjustments are necessary. This figure showed up in the biomechanics chapter in chapter 10 in your essential science. And these are the factors that we're kind of looking at when we're trying to consider postural, mostly stability. And from that, then the ability to have movement. So this is some background information related to that. And here's a box. These are anatomical landmarks that you can use during palpation or observation to help you do your assessment for symmetry. And then it gives you some ideas of what would interventions look like. Now the next one is gait assessment, and it follows the same type of pattern. Again, I refer you back to chapter 10 in the Essential Science book. And then here are common intervention procedures that we could use to try to encourage the most optimal gait that client can have at that particular time. So stop and pay attention to the key points here. This tries to summarize information and point out things that you want to have retention on. These are some figures related to joint movement, because we are moving into that assessment of joint range of motion. And this is where I'm going to stop this particular video, and we'll start up with a part 2 of this chapter in Fundamentals of Therapeutic Massage. So as we get into these more complex chapters, the discussions become more complex. That would make some sense, right? So even if the videos that I've been doing are a little long, this one's probably 45 minutes. I don't like them to go in much longer than that. You can still start and stop these. You do not have to listen to them all in one setting. And the nice thing about them is you can go back and look at them over and over. So we're going to end this video and pick it right up again and look at joint movement as assessment.